The patient in this case study suffered a traumatic amputation of his right arm 2 years ago. At the beginning of treatment, I was interested in how he was able to move the phantom, because he described it as clenched and very tight. This way you can make the tightness he feels in his phantom arm and hand visible. He was instructed to move his left hand so that the right hand, which only he can feel, can catch up with the left one. This was all recorded during the first session. As you can see, the movements are very slow. He basically lost voluntary control of the muscles of his elbow, hand and fingers. This led to his fingers being clenched, his whole arm feeling very tight, and this is of course tiring if you have to endure it for 10 to 12 hours a day, not to mention extremely painful at times. At first we showed him how to do mirror therapy for the elbow only, because that was the first joint we concentrated on. This is how it affected his movement speed after 1 week of twice daily sessions of about 30 minutes. Much improved. After his elbow and wrist were back under his control, we concentrated on his fingers, because this is the area we didn't improve at all during the first sessions. Again, he was instructed to give the right hand, his phantom hand, time to catch up to the position of the left hand. And you can see in this video how long it takes for his right hand to completely unclench, to open the fingers. Since the other exercises we did with his hand and fingers didn't work at all, we tried to integrate multisensory information, not only the visual information by looking into the mirror, but also by using auditory information. A clue that your brain gets that your hand has opened is, for instance, when you drop a pen. If you hear it, you and your brain know, yes, my hand has just opened. But even after 2 or 3 weeks, you can see that the speed hasn't improved at all. Not all his fingers showed the same problem. His thumb and index finger were actually pretty good. It was just the other 3 fingers which were still tight and clenched. This could be due to the fact that he is wearing a myoelectric prosthesis, in which those 3 fingers don't move. So his brain has learned that there is nothing to move. Another way to integrate multisensory input is working with heat, cold packs, brushes, rough surfaces, anything you encounter during a normal day. A very powerful illusion, even in healthy volunteers, is touching your own fingertips while looking into the mirror. After a few seconds it feels like the mirror vanishes and you are actually touching your one set of fingers with the other fingertips. In addition to twice daily mirror sessions, he was provided with magazines and instructed how to do right-left discrimination. This is one way which is very easy, cheap and fun to do. One added bonus is that the hands you see in these magazines are all engaged in activities of daily life. If the patient is able to tolerate this level of training, then why use flashcards with hands only? After a while, when the patient gets really good at this kind of training and is making rapid progress, you have to make it more challenging so that he still concentrates on the task. Here he has to mark one right hand and then one left hand. You could also say, okay, mark 2 right hands, 1 left hand, or any combination that engages him mentally more than just doing the same thing over and over again. Thanks for watching. If you have any questions regarding this patient or mirror therapy in general, feel free to comment.